How are we doing today? My name is Johnny and I'll be your student nurse for today. Can I get your first and last name, please?
Yeah, Willie Stella,
And your date of birth.
9/15/2000.
It's your hospital tag? Everything checks out. Alright, can you tell me what day of the week it is?
It is Friday.
And who the current president is?
Joe Biden.
Awesome, wonderful. Okay, so today we're going to be doing some assessments. We're going to start off with the head, we're going to go on to the neck, the eyes, the ears, the nose, and the mouth, and I'll walk you through all the different steps. So if I can have you swing these legs around, okay? If you're able to and you feel comfortable, we're going to go ahead and get some gloves on. We're going to start off with the assessment of the head.
Okay.
Then I'm going to go ahead and palpate your head. So if I can have you remove your facial, yeah, that'd be awesome. Get these gloves on. So as I palpate your head, I want you to let me know if you feel any type of pain at all. I'm going to assess for the skull shape, and I'm going to feel for any types of bumps at all.
Okay.
Okay, almost there. Okay. So I'm going to go ahead and palpate your head now.
Okay.
So I'm feeling for any types of bumps, feeling for the shape, the configuration of the head. Hair looks good. It's like a very, it's like a dark black color. There's good shine in the hair. Hairline looks good as well. I'm going to go ahead and check in the back. Okay, and did you feel any type of pain at all?
No.
No, awesome. Okay, so can I have you remove your mask?
Yeah.
Okay, so I'm going to go ahead and feel for your TMJ.
Okay.
So I'm going to test for the 7th cranial nerve. Can I have you move it up, down, side to side? Awesome. And I'm going to go ahead and check for jugular venous distension as well.
Okay.
So I'll have you look directly there. Awesome. Switch over to this side. Same thing. Okay, so can I have you raise your eyebrows up and smile really big? And can I have you make a super sad face frown and puff your cheeks out? Okay. Awesome, wonderful. So we're testing for the 5th cranial nerve, and one more thing, I'm going to go ahead and palpate your frontal and your maxillary sinuses.
Okay.
So I'm going to feel for tenderness. Here are the frontal sinuses and the maxillary sinuses. I didn't feel any type of tenderness at all. Did you feel pain?
No.
No, awesome. Okay, now we're going to go ahead and test the 5th cranial nerve. I'm going to go ahead and have these 3 objects here. This will be dull,
Okay.
this will be soft, and this will be sharp.
Okay.
So I'm going to have you close your eyes. I'm going to touch different parts of your face, and I want you to let me know what type of surface it is and where you feel it, okay?
Okay. Soft on my left cheek.
Good.
That dull on my nose. Sharp on my forehead. Sharp on my chin.
Okay, awesome. Those were all correct. We were testing the 5th cranial nerve.
Awesome.
I'll put this to the side for now. Okay, so what I'm going to do now is I'm going to go ahead and palpate for the different lymph nodes, okay?
Okay.
Actually, before I do that, I'm going to go ahead and pull the skin right here.
Okay.
I'm going to assess for skin turgor. It went back immediately. That means you're well hydrated. Same thing on this side. Good, good, good. All right, can I have you push against my hand? We're going to test for the 11th cranial nerve.
Okay.
Good. Same thing on this side. I'm going to have you raise your elbows up. Awesome. Okay. We were testing for the 11th cranial nerve. You didn't have any issues with opposing the force. So that's all good, and everything's working well there. I'm going to go ahead and palpate the different lymph nodes now.
Okay.
We're going to start with the preauricular, postauricular, tonsillar, submandibular, submental, post-cervical, deep cervical, superficial cervical, deep cervical, and posterior cervical, and the supraclavicular. Awesome. And did you feel any type of tenderness at all?
No.
Yeah, as I was palpating, I didn't feel any type of some bumps at all, and it was all good there. Awesome. So now we're going to move on to, I'm going to have you cough. Can I have you cough? Okay, and then I'm going to have you swallow something. So before I give this to you, can I have you swing your feet around if you're able to? Awesome. And I'm going to go ahead and hand this to you. So I'm going to have you swallow half of that. But before I do that, can I have you turn your head to this left-hand side?
Okay.
Okay, I'm going to go ahead and put my hand on your thyroid gland, and I'm going to feel for it, okay? Can I have you swallow half the water? Awesome. And can I have you switch over to this other side?
Okay.
And swallow half the water as well? Okay, good. I felt the thyroid gland moved as you swallowed. And can I have you swing around? I can hold this.
Okay.
Okay. Can I have you look up? I'm going to go ahead and look at the way that your trachea is shaped. I'm not seeing any type of deviation at all. And I was able to palpate the thyroid gland when I had you swallow. Okay, we're all set. Now we're going to move on to the assessment of the eye. So I'm going to go ahead and have you swing around one more time.
Okay.
You able to? I know it's an abracadabra today. And since I'm going to be getting a bit closer, can I have you put on your face mask? Not the facial, just the face mask. Awesome, wonderful. Okay, so we're going to go ahead and move on to this part of the inspection. But before I do that, I'm just going to go ahead and look at your eyes like this. I'm looking for, I don't see anything coming out of the lacrimal glands. Color looks symmetrical in both eyes. You have a dark brown iris, and the pupil looks round. And I'm seeing a little bit of veins and arteries on the sides. Okay, I'm going to go ahead and get the ophthalmoscope now.
Okay.
All right. So I'm going to go ahead and look for the red light reflex. I'm going to have to take this off too. I'm going to get a little bit close. Okay, I'm seeing the red light reflex on this eye, the red light reflex on this eye. That part's good. I'm going to get a bit closer and I'm going to see the different parts of your eye just a bit closer, okay?
Okay.
Let me know if I get too close. Okay, I'm seeing the pupil is round. I'm seeing veins and arteries. And the color of the iris is that dark brown color. I'm going to switch over to this eye now. Iris color matches. I'm seeing the veins as well, probably because all the homework us nursing majors have to do. Awesome, wonderful. Okay. Now, what I'm going to do is I'm going to go ahead and have you switch over to this other side. We're going to do a couple more tests.
Okay.
All right. Now we're going to test for the. We're going to do several tests. We're going to test all the different cranial nerves for the eyes, and that includes the second, third, fourth, and sixth cranial nerve. So I'm going to go ahead and do that now. I'm going to grab my pen light and this cotton swab. So first off, I'm going to test for the corneal reflex. I'll just have you look directly here.
Okay.
I'm going to bring this a little bit closer to your eye. Awesome. I saw you blink on this side. That's good for the corneal light reflex. Same thing on this side. Awesome. Okay. And I'm going to go ahead and check for the way that this light bounces off. So I'm going to test for the corneal light reflex.
Okay.
So I'll have you look directly this way. Okay, light's bouncing off at your eye on at the right angle on both sides. So that's what it should be doing. Now I'm going to go ahead and test for the way that your pupils contract and the way that they dilate. Okay, that one contracted. Same with this one as well, and they dilated afterwards. Okay, I'm going to go ahead and test for the peripheral vision now. So I'm going to have you look at this, or I'm just going to have you look directly here with your eyes in your face, and then I'll have you just say okay when you see this come into your vision of sight.
Okay.
Okay?
Okay.
Okay. Go from here now.
Okay. Okay.
All right, now I want you to, your head's going to be in the same spot, but we're going to test the 6 cardinal fields, and I want you to follow my plan, okay?
Okay.
We're going to start up here. Awesome. Okay, I saw your eye move without an issue. We're testing the second, third, fourth, and sixth cranial nerve, and I didn't see something out of the normal. All right. Okay, we're going to go ahead and move on to the inspection of the ears now. So I'm going to go ahead and palpate your ears. Okay, so I'm going to feel for any types of bumps. I'm going to inspect the shape of the helix, and I'm going to look to see if there's any type of exudate coming out of your ear. Okay, I'm not seeing anything come out of your ear. I'm feeling for bumps. Let me know if you feel any type of pain at all. Is there pain at all?
Nope.
Nope. Awesome. You take good care of your ears. I'm not seeing any dirt back here. I'm not seeing any earwax from my initial impression. The outer part of the ear. The helix seems to be the same shape on both ears. You do have a freckle on this ear. I have the same thing. It's kind of cool. I think it means good luck. And I'm not feeling any bumps. And there's no earwax on both of the ears as far as my as far as my assessment of the outside of the ear. Okay, so I'm going to go ahead and perform a hearing test. So if you're comfortable there, I'm going to go ahead and walk around to this other side.
Okay.
Okay, and I want you to cover this ear first. I'm going to say a couple words. I want you to repeat those words back at me, okay?
Brown beans.
Brown beans, good. And then can I have you switch? Cover that ear. Okay. Black coffee.
Black coffee.
Awesome, wonderful. All right, so that you were able to hear for the whisper test, and that means that you have good hearing. You were testing for the 8th cranial nerve, and we're testing for the hearing. Okay, now if I can have you move around, if you're able to swing these legs around. I know we're gonna have a bit of an ab workout today. I know it's a workout, and I'm gonna go ahead and inspect the internal parts of your ear. I want to specifically look at the way that your tympanic membrane is looking. So I'm going to go ahead and get this otoscope ready. Okay, now just a heads up, I'm going to pull your ear up and out so I can make sure that I can see the whole tympanic membrane. That's what I need to see. So let me know if I go too far in, okay?
Alright.
Okay, got a little bit of earwax, some hairs, and the tympanic membrane is pearly gray. Awesome. Okay, and I'm going to switch over to this other ear. Okay, I'm going to lift up and out. Okay, I'm not seeing any edema at all. You have a little bit less earwax in this ear. I'm seeing the pearly gray of the tympanic membrane, and I'm seeing a little bit of arteries as far as this tympanic membrane goes. Okay, and you have a hair in there too. Huh. I think it might be from a previous haircut, but hey, it's there. I think I might have some like those too. Okay, I'm going to go ahead and dispose of this now. Alright, so as I checked your ear and the internal structures, I didn't see any type of edema at all, not that much swelling. Although on that ear, I did see a couple veins coming from the tympanic membrane, and both of them were pearly gray.
Awesome.
Okay, let me dispose of this. All right. Now, if I could have you swing around one more time, that'd be awesome. Okay. I'm going to test for the patency of your nose now. So if I can have you push against one nostril, breathe in and out. Can I have you move your face back? That's going to help me out a lot, actually. Yeah. Okay, same thing. Push against one nostril, breathe in and out. Okay, then switch. Awesome. Okay, then if I could have you, let me get some gloves on first. But what I'm going to do is I'm going to have you smell some things, and I want you to tell me what you smell.
Okay.
Yeah. It's always fun to get these gloves on after all that foam hand sanitizer, you know. Always fun. Okay, so I'm going to have you close your eyes, and I'm going to go ahead and have you smell some things, okay? Okay. Let me know what you smell.
Is that mint?
Mint, awesome. Okay, I'm going to grab a different one now. Okay. Let me know what you smell this time.
Is that mint?
Mint as well, it's because it was the same one. You passed the test. Awesome.
Sweet.
Alright. Okay, and then if I could have you swing around one more time, that would be awesome.
Oh, okay.
Okay, I'm going to go ahead and look at your nose now. I'm going to look more towards the internal structures of your nose. So I'm going to get this otoscope one more time. Okay, so if I can have you look up, and we'll look inside your ear. I mean inside of your nostril. Okay, I'm seeing a little bit of mucus. I'm seeing lots of hairs, which is normal. And I'm not seeing any other foreign bodies in your ear. I mean, in your nostril. I do see a booger in there too. Alright, I'm going to switch over to this other ear now. I mean, to this other nose. Okay, I'm not seeing anything out of the ordinary. I'm seeing a little bit more mucus on this one, and you have a little bit of dry skin in there. And I'm seeing a little, actually there's less mucus in this one than the other one, and there's about the same distribution of hairs inside of this nostril as well. Okay, awesome. So you're all set with using the otoscope and the ophthalmoscope. We're going to go ahead and move on to our final test. So if I can have you swing around, that'd be awesome.
Okay.
Okay, and we were testing for the 8th cranial nerve, and we were doing all those tests for the ears. All right, so we're going to go ahead and move on to the assessment of the mouth. So I'm going to have you open your mouth. They're going to have you move your tongue side to side, then up and down. Okay, awesome. All right. Since I have you here, I'm going to go ahead and have you stick your tongue out.
Alright.
And then can I have you say ah?
Ah.
All right. Okay, can I have you say it one more time?
Ah.
Ah, okay. And I'm seeing your tonsils and your uvula. I'm seeing an even distribution of teeth. Can I have you open your mouth a little bit wider? Awesome. I'm not seeing any lesions. The color is pinkish, like a really light red. Not seeing any cuts as far as the upper part of your mouth goes. Can I have you raise your tongue up? Can we see under? I'm going to inspect underneath. Okay, I'm seeing some veins and some arteries. That should be normal. Can I have you tilt your head down just a little bit? Yeah. Same thing on this side. Just make your tongue up for me. Okay, I'm not seeing any cuts as well. I'm not seeing any lesions. And the color seems to be distributed the same everywhere. And you seem to be having all of your teeth in there. Awesome. Okay, now this is the best part of the whole assessment. We're going to go ahead and test for the gag retest, okay? So, let me know. Actually, you would tell. All right, awesome. I know. Fun stuff, right?
Man.
Gotta love it. All right. And then we're going to be testing your taste of, so we just tested for the 9th and the 9th and 10th cranial nerve. And we're going to go ahead and test, and when I have you move your tongue side to side, that was the 12th cranial nerve.
Okay.
Awesome. Now we're going to go ahead and test your sense of taste. Okay, so I have 3 different flavors here. We have a salty, we have a sweet, and then we have a sour. I want you to tell me which one you hear. I'm going to go ahead and put it on the anterior portion of the tongue and then the posterior portion of the tongue. Okay? Yeah, so we're going to be testing for the 12th and the 7th cranial nerve.
Alright.
So, if I can have you stick your tongue out. Alright, how did that one taste to you?
Is that sweet?
Sweet. And I'm going to test on the posterior portion of the tongue. If I can have you stick your tongue all the way out. Okay, how did that one taste?
Sweet.
Sweet, alright. We'll go ahead and dispose of those. Okay. Alright. I'm going to start with the anterior portion of the tongue. What did you taste?
Is that sour?
Sour. And the posterior portion of the tongue?
Sour?
Sour. Alright, good, good. Alright, so you're almost done. Alright, the anterior portion of the tongue?
Salty?
Salty. And the posterior portion?
Salty. I guess.
Salty. Okay, so you were able to pick up all 3 of the different flavors with at about I would say about the same for the anterior and the posterior part of your tongue. Alright, now we're going to go ahead and move on to the Weber and the Rhine test. So what I'm going to do is I'm going to hit this and I'm going to put it on the top of your head.
Okay.
And I want you to tell me if you hear the sounds the same on both sides, okay?
Okay.
You hear it equally on both sides?
I do, yes.
Awesome. Okay, and then we're testing for the 8th cranial nerve one more time. Okay, now I'm going to go ahead and do the Rhine test, and I'm going to go ahead and put this on your mastoid bone. We're going to test for the conduction there, and I'm going to have you, I'm going to put this next to your ear, and I want you to tell me when you stop hearing it then.
Okay.
So when you stop hearing it, just say okay, and I'll switch to the next spot. Okay, we're going to start off with this right ear first. Okay, let me know.
Okay.
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 Okay, and that was about 15 seconds on the mastoid bone and about 27 seconds next to your ear. And that's good because you should hear twice as long when it's next to your ear than when it's on that mastoid bone.
Oh, okay.
Okay, we're going to do the same thing on this opposite side, okay? So just say okay when you stop hearing it. Awesome. Okay, so that was about 17 seconds for the when it was on that mustard bone, and about 35 when it was next to your ear.
Oh, perfect.
So, and it's about the same on both ears, and it's good because when it should be on the bone, you had about twice that length when it was next to your ear. So as far as that goes, those are within normal normal ranges.
Awesome.
Okay, now there is one more thing I have to do before I go. I'm going to go ahead and palpate your carotid arteries. I'm going to start with this one first. Okay, I would say it's a 2 and a 3. It's not quite that that bounding, but it's definitely palpable. I'm going to switch over to this one now. Okay, pulse is symmetrical on both sides. Yeah, it's in between a 2 and a 3. It's definitely palpable on both sides, but it's not quite that, bounding. All right, I'm going to go ahead and auscultate them now with the bell of the stethoscope. So I'm going to have you hold your breath on the count of 3, and that's going to help me hear what I have to hear.
Okay.
Okay, so I'm going to have you hold your breath on 3. Ready? 1, 2, and 3. I'm listening for breathe, and you can exhale. Okay, I didn't hear anything on that side. Let's switch over to this side. On 3, hold your breath. And I'm not hearing anything on this side either. Awesome, you're all set to go, and you can exhale. Okay, all right. So, Mr. Soa, I didn't hear any type of breathe on either side. And that concludes our assessment. If you can get back into a comfortable position, if you're able to, that would be awesome. Okay, now I'm going to be stepping out now. If you have any questions, please let me know. Thank you so much. You were an awesome patient. And as far as the assessment of your head, neck, eyes, ears, nose, and nostril, I am happy to say that you are within normal limits and that your hair looks awesome as well.
Awesome.
Okay,
Thank you.
the call light's right here. I'll be stepping out now, and if you need something, just press the call light. I'll be here as soon as I can. Thank you so much.